We start by making incisions in the front of the knee, which will allow us to access the inside of the knee and then clean out the torn portion of the anterior cruciate ligament. Here, we are working on cleaning out the tibia insertion on your shin bone side. And then we make an incision on the inside part of the knee and make sure that we can reach the proper position or the anatomic position of the ACL on the femur or thigh bone side. We place a guide pin in the femur side in the anatomic position, and then we bring a drill bit called a reamer to make a socket, which creates our femoral tunnel. This will be where we pull our graft for our ACL up and into the joint and secure it in place. With our passing pin in place, we loop a suture on it, and the suture will allow us to pull our graft into the joint across the tunnels. So for now, we're going to sew this into the femoral tunnel so that we can retrieve it later through our tibial tunnel. Once we have this secured in its position, we turn our attention to the tibial tunnel. Here, we bring in a drill guide, set up a specific angle that will let us bring a pin through the bone and up into the anatomic position of the old ACL. Once the guide pin comes into place, we protect it, and then we bring a large reamer or another drill bit over the guide pin to create our tibial tunnel. We then pass our ACL graft by grabbing the suture we had previously put up in our femoral tunnel and bring it out through our shin bone. We placed our tensioning pins in place so that once we secure it on the thigh bone, we can independently tension the anteromedial and posterolateral bundles and get a true double bundle ACL reconstruction through a single socket. Now we apply the tensioner to our graft strands, independently tensioning the anteromedial and posterolateral bundles at their appropriate location and at the appropriate tension. We then put the knee through a range of motion to take any extra stretch out of the graft before we secure it in place with another screw in the tibia. This maintains the tension on the graft while we remove our graft tensioner. And now we have completed our double bundle single socket anterior cruciate ligament reconstruction.